Have you ever wondered what causes those pesky pimples on your face? Welcome to our deep dive into the world of acne, a skin condition as common as it is misunderstood. This condition, characterized by blackheads, whiteheads, and pimples, is a universal experience that impacts millions of people across the globe. It's most prevalent among teenagers and young adults, but it doesn't discriminate. Anyone can get acne. It's not just about the physical appearance either. Acne can have significant emotional and psychological impacts, often leading to decreased self-esteem and increased stress levels. It's a condition that goes beyond skin deep. Acne is a fascinating topic because of its complexity. It's not just about having a bad skin day. The condition involves a complex interplay of factors, from clogged hair follicles to inflamed papules and pustules. Some forms of acne can even lead to scarring if not treated properly. Now, are you ready to delve deeper? Stay tuned as we delve into the intricacies of acne, its causes, types, and treatments. To understand how to fight acne, we need to first understand what causes it. Acne, particularly the most common form, acne vulgaris, is a multifaceted skin condition with multiple contributing factors. First, let's talk about oil, specifically sebum, which is a natural oil produced by our skin. Now, sebum isn't inherently bad. In fact, it's essential for keeping our skin moisturized and healthy. However, problems start when there's an overproduction of this oil, usually driven by hormonal changes, particularly during adolescence and certain phases of the menstrual cycle. This excess oil creates an environment where acne is more likely to develop. Next on the list is the clogging of hair follicles by this excess oil and dead skin cells. Our skin is constantly renewing itself, and as part of this process, old skin cells are shed. If these cells don't shed properly, they can mix with the excess oil to form a plug, creating an environment ripe for the next culprit, bacteria. Enter Propionibacterium acnes, or P. acnes, a bacterium that's naturally present on our skin. In normal amounts, P. acnes is harmless. However, when trapped in a plugged follicle, it can multiply rapidly, leading to inflammation and the formation of those dreaded pimples. Lastly, we have hormones, specifically androgens. These hormones increase in boys and girls during puberty, causing the skin's oil glands to enlarge and produce more sebum. Hormonal changes related to pregnancy or starting or stopping birth control can also cause acne. It's important to note that despite popular belief, acne is not caused by dirt or lack of hygiene. Washing your face excessively or scrubbing your skin too hard can actually make acne worse by irritating the skin and making inflammation worse. Now that we know what causes acne, let's move on to the different types of acne. Not all pimples are created equal. There are different types of acne, each with its unique characteristics. Let's start with blackheads and whiteheads, a common duo when it comes to acne. Both are types of comedones, which are essentially clogged hair follicles. Blackheads are open at the surface of the skin, giving them a black appearance due to the oxidation of melanin. Whiteheads, on the other hand, are closed at the surface by a thin layer of skin, appearing as small white bumps. Next up are papules and pustules. Papules are small red and inflamed bumps that lack a head. They occur when the walls surrounding your skin pores break down from severe inflammation. Pustules, on the contrary, are like papules but with a twist. They're filled with pus, giving them a yellow or white center surrounded by a red halo. Now, let's move on to the heavy hitters, nodules and cysts. Nodules are large, painful, and solid to the touch. They live deep beneath the skin's surface and are caused by a buildup of secretions deep within hair follicles. Cysts, the most severe form of acne, are also deep within the skin, filled with pus, and can cause scars. Both nodules and cysts often require a dermatologist's intervention to prevent scarring. Lastly, there's a type of acne often seen in athletes, acne mechanica. This is triggered by excess heat, pressure, or friction on the skin, often under athletic equipment. It's not limited to athletes, though. Backpacks and tight collars can also lead to this type of acne. Each of these types of acne can range in severity, from mild to severe, and the treatment options will vary accordingly. It's crucial to understand that acne is not a one-size-fits-all condition. Each type requires a different approach and treatment. Understanding the type of acne you have is the first step towards an effective treatment plan. Acne can be a stubborn problem, but with the right treatment, it can be managed. Let's delve into the myriad of treatment options available for acne. They range from over-the-counter solutions to prescription medications, and even professional treatments offered by dermatologists. Each treatment type has its advantages and is designed to tackle different severities and types of acne. Over-the-counter medications are usually the first line of defense against acne. These are readily available at your local pharmacy and don't require a prescription. They typically contain active ingredients like benzoyl peroxide, salicylic acid, and sulfur. Benzoyl peroxide is known for its bacteria-fighting properties, while salicylic acid aids in unclogging pores. Sulfur, on the other hand, helps to dry out the skin and reduce inflammation. For those who have stubborn or more severe acne, prescription medications may be necessary. These include topical treatments like retinoids and systemic treatments like antibiotics or isotretinoin. Retinoids work by accelerating the process of skin cell turnover, pores. Antibiotics can help to combat bacteria that contribute to acne, while isotretinoin is typically used for severe forms of acne that haven't responded to other treatments. Professional treatments are another avenue to explore, especially for those dealing with severe or persistent acne. Dermatologists may offer procedures like chemical peels, light therapy, or even drainage and extraction for larger acne cysts and nodules. These treatments can sometimes be more effective, but they may also come with a higher price tag and potential side effects. But remember, treating acne isn't just about medications and procedures. It's also about maintaining a good skincare routine. This includes cleansing your face twice a day, using oil-free makeup, and avoiding harsh skin products that can irritate your skin and exacerbate acne. Also, resist the urge to pick or squeeze your acne, as this can lead to scarring and further inflammation. Lastly, bear in mind that while these treatments can be effective, they are not quick fixes. Acne treatment often takes time and patience. It may take several weeks, even months, to see significant improvements. So don't be disheartened if you don't see immediate results. Remember, the best treatment for acne is the one that works for your unique skin. It's all about finding the right balance that suits your skin type and addressing the root cause of your acne, so don't hesitate to reach out to a dermatologist or skincare professional to guide you through this journey towards clearer skin. So, to recap what we've learned about acne, it's a common skin condition characterized by blackheads, whiteheads, and pimples, and can affect various parts of the body, including the face, chest, shoulders, and back. Remember, acne is a part of life for many people, and there's no need to feel embarrassed about it. We've explored the causes of acne, which are multifaceted. It's often a combination of factors such as hormonal changes, stress, and certain medications that can trigger an outbreak. External factors like friction and pressure on the skin can also lead to a specific type of acne known as acne mechanica, frequently seen in athletes. In terms of the types of acne, we've uncovered that they range from mild forms like comedones, clogged hair follicles that develop into whiteheads or blackheads, to more severe forms like nodules and cysts. These larger, painful lesions may require dermatologist treatment to prevent scarring. We also touched on extreme forms like nodulocystic acne and acne conglobata, which necessitate prompt dermatological intervention to minimize scarring. When it comes to treatment, the severity of the acne often dictates the approach. Topical therapies like benzoyl peroxide can be effective for milder forms, while systemic treatments, such as antibiotics or isotretinoin, might be used for more severe cases. It's crucial to remember that treatment should be tailored to the individual, and what works for one person may not work for another. In essence, understanding acne is the first step towards managing it effectively. It's a common issue that affects millions of people worldwide, and with the right knowledge and treatment, it can be controlled. Knowledge is power. Understanding acne can help you manage it better and live a happier, more confident life.